Okay, I think we'll make a start. So, good evening, everyone, and thank you very much for joining us this evening. My name is Martin Hamilton. I'm director of Leeds Civic Trust, and I'm delighted this evening to welcome Dr. Emma Storr, who will be giving a talk on factories and fevers, child health in the 19th century. Emma is a poet, a retired GP, and an academic. But this evening, she's a historian. This is the first of 3 talks that we're laying on this month on Wednesday evenings, on alternate Wednesday evenings. I'll say a bit more about the other 2 talks that are coming up at the end of this one. Now, the plan is that we'll take questions at the end of Emma's talk. So if you want to use the chat function either to comment or to provide information that you think might be of interest, please do that. But also, if there are some specific questions, then please also use the chat function to put those questions to Emma, and then we'll mop those up at the end of the talk and have a short Q&A session before we finish. So without further ado then, Emma, would you like to introduce yourself and start the talk? Thank you.
Great. Thanks very much, Martin. And thank you all for giving me this opportunity to talk to you, albeit in a sort of virtual capacity, on the topic of factories and fevers, child health in the 19th century, particularly in Leeds. A little bit of background on me. I am a GP, but I've now stopped working as a GP, and I still do occasional teaching at the University of Leeds. And one of the modules I teach for medical students is on the ill child in history, in which we look at child health in the 19th century and compare common conditions from the past with the problems we see in children in the modern world. And we're very lucky in Leeds because we've got so many resources to help with this sort of research. The Thackray Medical Museum, the Special Collections Library within the Brotherton at the university, and the many factories, mills and archive material they provide. But I'm an amateur historian, and I'm aware that some of you may have deeper knowledge than me about this topic. So, I'm going to start with a little bit of historical background just to put things in context. And then I'm going to concentrate on 2 aspects of life in 19th century Leeds that affected child health in particular. Firstly, the impact of the Industrial Revolution and the growth of textile mills and factories that employed child labour, which led to occupational diseases. And then related to this, the infectious diseases, the fevers that were rife in big cities such as Leeds, and why they caused such a high morbidity and mortality in any big city. Some of this material will be familiar, I know. And I'll also touch briefly on the fascinating topic, I think, of sanitation and public health, because of its relevance to the spread of infectious diseases and the growing awareness of the importance of public health to improve conditions. And lastly, I'll talk very briefly about some of the legislation that came in the form of Factory Acts that led to improvements in health and working conditions for everyone throughout the 19th and 20th centuries. So what was Leeds like in the 18th and 19th century? Well, as you know, it was a period of enormous expansion because of the Industrial Revolution. So industries, particularly the textile industry, wool, flax and cotton, but also engineering and iron industries were growing at an enormous rate. And this led to Leeds being the 4th largest city in England and known as the capital of the North. The development of the industry, of course, led to an enormous demand for labour, and the population expanded as people flooded to the cities to take up work in the factories and the mills. There were lots of other industries and guilds, of course, active in Leeds during this time: coachmakers, clockmakers, jewellers, booksellers, bakers, barbers, innkeepers, lots and lots of craftsmen. But one of the reasons that Leeds expanded so much was the transport links improving. So railways were being built, and the canal, the Leeds-Liverpool Canal, was completed in 1818. And this meant Leeds was connected with both Liverpool in the west and Hull to the east. And the city became a sort of central hub for manufacturing, because raw products could be transported up to the factories and then manufactured goods taken back for purchase and export. There was a big change during the 18th and 19th centuries everywhere, from domestic industry, cottage industries, to enormous factories and mills being built. But this also led, of course, to a lot of urban poverty with overcrowding and disease, and rather cheap housing being built, which had poor drainage and sanitation. And certainly there was an increase in the poor and destitute. This is a painting, Artist Unknown, from 1844 of Leeds. And I think you can see straight away that the air was extremely polluted, with many, many chimneys belching out soot and smoke, adding to the risk of respiratory diseases like bronchitis and asthma. And also the river Aire was incredibly polluted, because basically people tipped a lot of waste into the river, including the tanneries, the dye works, the sewers where they existed, and lots of what were known as offensive drains. So the river was particularly horrible. And also there were a lot of slaughterhouses discharging blood and guts into the river and the streets. So everything I've read about 19th century Leeds makes me very pleased to be living in 21st century Leeds, because life was polluted, smelly and dangerous at this time. So thinking about children at work, actually children have been working in mines and as sweeps in the 17th and 18th centuries, and probably before that. And many of them led very miserable, short lives because of injury, deformity, inhalation of soot and coal dust. And you'll know that little boy sweeps could develop scrotal cancer because the soot was carcinogenic. It caused cancers. Until the late 18th century, the consensus was that children should be productive for both economic and moral reasons. And of course, child labour in the domestic system was very common. And really the concern about child labour only arose when factories started employing large numbers of children, and people could see the moral and physical effects of early factory work and the fact that many children died. One of the people who was very concerned about child labour was Lord Ashley, sometimes known as Lord Shaftesbury as well, Anthony Ashley Cooper. And he actually commissioned a report of children's employment in 1840, because he wanted to find out where children were employed and what the conditions of work were. It took 3 years to complete this report, and it comprised thousands of pages of oral testimony, some of it from children as young as 5. And when it was published, it shocked society, and it did lead to legislation to secure minimum standards of safety in mines and factories, as well as general controls on the employment of children. But I thought it was really interesting to see all these different industries, many of them connected with the textile industries that children were employed in. I would, of course, if you were a live audience and could respond, I would ask you, what is this plant? But I'm afraid I'm just going to tell you, I'm sure some of you recognize it. It is flax, which is, of course, the raw material to make linen. And there were many flax mills built in Leeds. One of them was Castleton Mill, built in 1836. And the second one I'll come on to in a minute. So flax was the fibrous material that was treated in order to turn it into thread, so it could be sent to weaving factories and then turned into linen. The conditions in flax mills were extremely hot and humid, making the flax easier to work, but also leading to dehydration and probably the spread of disease in the very moist air, as well as people fainting and then injuring themselves. I know you'll recognize this famous Marshall's Temple Mill, which was also a flax mill built in 1840 in this wonderful Egyptian style based on the temple at Edfu. And one source I looked at said that early textile mill owners revealed a marked preference for the labour of women and particularly children. They were thought to be more amenable to the monotony and unrelenting pace of work of the new machines. And of course, factory owners needed cheap labour to try out new production processes. Marshall was actually considered to be one of the most liberal factory owners of the Industrial Revolution, and in his factories, overseers were not allowed to use corporal punishment on the workers. But employees at Temple Works worked 72 hours a week. And I thought it was really interesting that 40% of the people employed by Marshall were young women, aged 13 to 20. And about 20% were under 13. So there were a lot of young people, children working at this mill. Apparently younger children were encouraged at this mill to attend day school, and older children were given free education on Monday afternoons, because we'll see later that the mills did have to provide some minimum education for their children. Another fact, again, I'm sure many of you know, that apparently Temple Mill had a roof of a layer of earth 8 inches thick, sown with grass, and sheep grazed on the top. But let's come back to some of the health problems. So children were working perhaps 12 or even 14 hours a day in these mills and factories, and sometimes overnight. And this led to many physical problems, including distortion of the knees, ankles, and feet due to long hours standing. And as children, of course, their bones hadn't mineralized and strengthened, and their ligaments were soft. And so we have evidence from doctors at the Leeds General Infirmary saying that they're seeing children with permanent deformities due to these long hours of standing with bowed legs and their bones not producing enough mineral. There was also the respiratory problems of inhaling dust, cotton and wool fibres, leading to asthma, bronchitis, and byssinosis, which is damage to the lungs caused by inhalation of dust. Anthrax, a bacterial infection, was also around. That's also known as wool sorter's disease or maladie de Bradford. Many of the children and adults would have been malnourished. They were living on a very poor diet. They hardly saw the sun, any daylight, so they had vitamin D deficiency, and rickets would have added to their problems of deformity. And we know that many of the workers in these factories were deaf due to the noise of the machinery. Accidents were very common, partly due to exhaustion, children falling asleep at work, but burns were common from the machines, just trauma, and sadly then often death. And we also know there was a lot of physical abuse by the overseers. Not a happy working environment. I thought this was very interesting that a letter from a surgeon at the LGI in 1822 said, "We have at the infirmary above 1,200 accidents in the year. Above half of these are from machinery, and to make a guess, 2/3 of the latter number happen to children under the age of 15, particularly the finger and hand cases." This is evidence from a woman working in Armley Mills, and she mentions, I think, at least 6 major hazards to health. So I'll leave you just to read that for a minute. Interesting that she says she used to work at Mr. Marshall's mill, but the dust was too much for me. So she's got dust inhalation, trauma to her finger, burns from the hot metal, she's deaf, and she's worried about her children. They're thin, pale and bent. And the alternative, of course, would be the workhouse. They've also been physically abused. We know children were employed partly so that they could crawl under the machinery in the big looms, say, and pick up threads and get into places where adults couldn't fit. And of course, that also led to injuries. And this was a horrible accident at Armley Mills in 1822, when a 13-year-old boy died following losing his leg. So this is, of course, pre-anaesthetic and pre-antiseptic practice at the hospital. So it was really a miracle if you survived trauma like this. I've put up Mrs. Gaskell, partly because she's a heroine of mine, but of course novelists like Dickens and Mrs. Gaskell chose to write social novels which did expose these very harsh conditions in which working families lived. And if you've read North and South, you may remember, excuse me, that the heroine Margaret Hale meets Bessie, a young working class girl employed in the cotton mill who has chronic lung problems because of inhalation of fluff and the very poor ventilation. So Bessie says, "Fluff, little bits as fly off from the cotton when they're carding it and fill the air till it looks all fine white dust. They say it winds round the lungs and tightens them up. Anyhow, there's many a one as works in a carding room that falls into a waste, coughing and spitting blood because they're just poisoned by the fluff." And she goes on to say it's because the mill owner is too mean to pay for proper ventilation. Poets were also, or poetry was also employed to campaign to improve the conditions that children were working in. And this very emotive poetry of the time was written both by MPs and by poets to describe the suffering of children working in factories, dying of starvation and overwork. And we know Richard Ostler, who we'll come back to, the factory king, who was a Leeds MP, commissioned John Nicholson, the Bingley Byron, a poet, to write The Factory Child in 1833, specifically to support the campaign for the 10-hour Act to limit the number of hours that children could work. And other poets added their voice, including Elizabeth Barrett Browning in 1843, in response to that report that Lord Ashley had commissioned, which shocked people about the sort of conditions that children were working in. So all of these poets added their voice to try and improve things for children and for adults in the factories and mills. I want to leave the industrial scene now and think about fevers, and in particular some of the common infectious diseases that were prevalent at the time. While it was clear that diseases could be spread between people, this was thought to be caused by the circulation of bad air, or miasma, from rotting plant and animal matter, or secondly, possibly caused by contagion, fermentation from organic materials spread by physical contact between people and articles. If we return to the topic of child health, it's important to realise that paediatrics wasn't really a separate specialty in the 19th century, but many doctors were beginning to realise that children did have different constitutions and needs to adults and were more vulnerable to disease. One of the early books written about child health was John Clarke's tome of 1815, which was called Commentaries on Some of the Most Important Diseases of Children. And he was really one of the first people to document observed differences between children and adults and note that children had an increased susceptibility to disease. He was also one of the first doctors to carry out epidemiological research, so looking at the patterns of disease. And he looked at the register of burials in London over a period of 40 years, from 1760 to 1800. And these revealed that over a quarter of deaths occurred in children under the age of 2, and about a fifth in children under the age of 10. He also identified big health inequalities in mortality that still exist today. And he made this comment that few children of the poor are reared, and a large proportion of the deaths in the bills of mortality, that's the register of burials, are among the offspring of this extensive class of the community. Their death, however, makes no noise and therefore little impression. He had a lot of common sense, John Clarke, and he said that in large cities and manufacturing towns, it was the bad air, overcrowding, want of cleanliness and inattention that led to disease and death. And he suggested that the disease should be separated from the healthy to prevent spread of infection. And he suggested establishing public hospitals for the poor, for those suffering from contagious conditions, where they could receive food and medical attendance. So moving on to thinking about what the common causes of disease were in Leeds. If we're thinking about infectious diseases, there was an outbreak of plague in 1645, which killed about a quarter of the population. And then there were 2 other cholera outbreaks in the mid-19th century, which also caused a lot of death. So other conditions that were prevalent, I'm sure you could imagine what those are, and many of them are still with us, although thankfully we have better treatments, much better prevention, and some of them have been eradicated completely. So I'm going to just whiz through this list and not talk about them individually, really. So as you see, we still have these conditions around, and of course in many parts of the world they are still significant cause of death in adults and children. Now, I did put malaria because it was actually around in Britain until around the end of the 19th century, but better living conditions and proper sanitation and drainage of swampy areas did lead to it disappearing. Other hazards which led to either disease or illness or death. I've mentioned some of them. Accidents were very common, burns, both in workplace but also at home where people had open fires. Poisoning, often because doses of medicines were not properly measured, and sometimes children particularly were overdosed with laudanum, opium mixed with alcohol to keep them quiet. Drowning was very common, both in the river but also people falling into cesspits. Septicemia, so overwhelming infection from perhaps an injury that then became septic and really spread throughout the body. We know people, particularly working classes, were very malnourished, and so that would also make them more susceptible to infections, but they also suffered from rickets and scurvy or vitamin C deficiency. Interestingly, bladder and renal stones were much commoner in the 19th century, not entirely sure why, although it may have something to do with people having recurrent urinary infections and the quality of the water. Cancers were around and did kill people, of course. We know Mrs. Bronte died of cancer. Hernia and bowel obstruction were common problems, and surgery for them was, shall we say, very dodgy. So you were lucky if you survived an operation for that. And of course, childbirth was dangerous and at that time. If we look at the infant mortality rate, so the infant mortality rate being the number of deaths in children under a year per 1,000 live births, this statistic is often used as an indicator of health and well-being of a nation. And in 1870, this reached a peak of 218 per 1,000 live births. Or another way of putting it is that more than 1 in 5 children died before reaching their first birthday. Maternal mortality was also very high, about 45 per 1,000 live births. And I'll come back to modern figures at the end of this talk. I'm sure you recognise Leeds General Cemetery in St George's Field, which opened for public burials in 1835. I was shocked to realise, having walked my students around St George's Field, that there are 97,000 people buried there. And the burial register, well, at least the entries in the burial registers cover a long time, 1835 to 1992, but it is still an extraordinary number. And nearly half of these are children under the age of 9. In the register, you can look at the age of the death, the cause of death, if known, and the occupation of the father. And this is a wonderful resource that's now been digitalized so that you can look at it. And of course, many of the deaths recorded were due to infectious diseases. I think the top 4 were TB, diarrhea, inflammation, bit non-specific, and bronchitis. Actually, looking at the causes of all deaths, not just children in Leeds Cemetery, unknown comes top. Stillborn is extremely high, but it did include children under the age of 1 and accounted for over 32,000 burials. And this list is in descending order of the numbers dying due to the condition. So you'll see TB is high up the list. And of course, TB did affect all classes, although the risk of infection and mortality was higher among the poor because of overcrowded living conditions, malnutrition, and lack of access to any treatment. So this is where public health comes in a very big way. Public health being defined as the science and art of preventing disease, prolonging life, and promoting health through the organised efforts of society. And it became increasingly important in cities where overcrowding, poverty, and poor sanitation led to the spread of infectious diseases. So we have 4 men that we need to talk about, because all of these people were instrumental in exposing the appalling conditions of the poor, and particularly poor children in Leeds, that then led on to important legislation on child labour and improvements in sanitation. I'm sure you know Dr. Charles Thackrah, an important figure, known as the father of occupational medicine, because he was the first doctor to report on diseases caused by work in trades and industries. And here's his wonderful book, published in 1831. The effects of the principal arts, trades and professions, and of civic states and habits of living on health and longevity, with a particular reference to the trades and manufactures of Leeds, and suggestions for the removal of many of the agents which produce disease and shorten the duration of life. So the book's strength was its breadth of coverage of over 100 trades in Leeds at the time. And in it, he addressed, for example, postural deformities that we've talked about in child mill workers, dust diseases in miners, and he made many important recommendations for prevention. And his work and speech in Parliament contributed to the passing of the Factory Act in 1833, which we'll come on to. But very tragically, Thackrah died of TB himself at the age of 38 in 1833. This is an extract from his report. The employment of young children in any labour is wrong. No man of humanity can reflect without distress on the state of thousands of children, many from 6 to 7 years of age, roused from their beds at any early hour, hurried to the mills and kept there with the interval of only 40 minutes till a late hour at night. And he goes on to talk about the noxious dust and how children need more sleep. Richard Ostler, the factory king, was a radical Tory MP who wrote a famous and emotive letter to the Leeds Mercury in 1830 regarding Yorkshire slavery, and both he and Michael Sadler, the MP, pointed out the hypocrisy of a society which campaigned to abolish slavery abroad, but actually was treating its working classes and children as slaves in the mills. And this is just one very short extract from that letter, that thousands of little children, both male and female, but principally female, from 7 to 14 years of age, are daily compelled to labour from 6 in the morning to 7 in the evening. Moving on to Dr. Chadwick, he was a barrister who became very interested in social reform, and having been involved in the poor law legislation, he commissioned a report on the sanitary condition of the labouring population, which was researched and published at his own expense. And one of the people he employed to report on Leeds was Dr. Robert Baker. He'd come to Leeds in 1824 as a newly qualified young surgeon, appointed to look after the medical needs of the poor. And he was shocked and moved by what he found in Leeds, by the wretched lives of the poor and the terrible conditions they lived in. So this Poor Law Commissioner's report on the sanitary conditions of the labouring population was completed in 1842. And Dr. Baker found that the working classes in Leeds were about 66% of the total population. He noticed a high mortality in the textile industries compared to other occupations. and health inequalities, the difference in mortality of over 50% in under 5 years of age children in different wards of Leeds. He said that the greatest number of children were employed in the woolen, worsted, silk, cotton and flax mills, and that they were the ones who died more than people working outside. So he noticed that for all occupations, outdoor bricklayers, gardeners and labourers had the longest life expectancy, and those in the mills had the lowest. He was also, before this, he documented the outbreak of malignant cholera in 1833 and showed that this outbreak of cholera in Leeds was definitely where people were living in very crowded and poorly drained areas. So he said that the state of the general health of the inhabitants would be greatly improved by a general and efficient system of drainage, sewerage and paving, and the enforcement of better regulations as to the cleanliness of the streets. So although he didn't know that cholera was water spread through water, contaminated water, he, this is 22 years before the famous John Snow and the Broad Street pump incident in Leeds, where he took the handle off the Broad Street pump when there was a cholera outbreak in London. This is an extract from Baker's report, and you'll see the conditions that people were sometimes living in Leeds was particularly grim. So public health campaigners helped to bring in the Public Health Act of 1848, moved in by Chadwick, who considered that the most important steps to improve the health of the public were these 4 points: improved drainage and provision of sewers, removal of all refuse from houses, streets and roads, provision of clean drinking water, and the appointment of a medical officer for each town. However, it took quite a while to actually get this done, and it wasn't until 1899 that it became compulsory for all dwellings in Leeds to be connected to the sewer system. And just a little more detail on waste. I thought it was interesting that in 1883, a survey in Leeds found these statistics. So a big problem, and one that contributed to the spread of disease, was how to dispose of human waste. And it wasn't, many households were sharing outside toilets, outside privies. A privy midden is an outhouse for public use. It's basically just a hole in the ground in a public dump. And there are various other sort of toiletry arrangements, but you can imagine, particularly where there was a lot of overcrowding, a lot of people using these, the spread of disease was very, very common. I'm just going to talk very briefly before I finish about some of the legislation that came in. So there was a whole series of UK labour laws designed to regulate conditions of industrial employment that came in over the 19th century. Many designed to aid all labourers, but there was often a focus on the welfare of children. One of the first of these was the Health and Morals of Apprentice Act in 1802 that was brought in by Robert Peel. And that actually required an employer to provide proper ventilation and cleanliness, as well as instruction in reading, writing and arithmetic during at least the first 4 years of a 7-year apprenticeship. Many of the apprentices employed were young pauper children who'd frequently been brought from distant workhouses to labour in the mills. And unfortunately, this act didn't really apply to free children, so children of families who were working and weren't apprentices. And of course, they tended to be by far the majority. However, this was the beginning, and there was further modification of this act in the next sort of 30 years. The Factory Act, the one that Charles Thackrah and others campaigned for, was very significant, and there were many reforms of this Factory Act over the next 100 years, which went on improving conditions for children particularly. So it limited what age they could be employed, it limited the number of hours they could work, and they were not to work at night, and the factories had to provide some schooling. But actually 4 factory inspectors appointed to enforce the law was a tiny number, and I suspect many factories didn't actually concur with this. But just going back to the infant mortality rate, you'll be pleased to know that it did plummet over the 100 years from 1900, well, yes, in the 20th century, from that awful figure we saw of 218 in 1870. And this was due to improved public health measures, better nutrition, and then, of course, immunisation of children against common diseases. And I haven't really touched on the medical advances that were going on. Infant mortality rate now is about 3.9 per 1,000 live births, and maternal mortality is more like 9 per 100,000 births. So we've done very well to bring those figures right down. But that's in the UK, and in many parts of the world, those figures are sadly much, much higher. And of course, we know there's a lot of child labour. So I'm going to finish now, so we've got a bit of time for questions. But just to say, I've talked a little bit about the occupational diseases, and particularly conditions in the textile industries that led to problems, particularly among children. And we know disability and death was very high compared to other industries. I've talked a bit about the infectious diseases that were rife due to overcrowding, poor sanitation, and malnourishment. And the Public Health Act was a really important piece of legislation that slowly led to great improvements, as did the Factory Acts. And as I say, I think medical advances is a completely different talk. So I shall leave it there. Some references, and thank you very much for listening.
Thank you, Emma. That was a really interesting and comprehensive presentation about child health in 19th century Leeds, and I'm sure a lot of food for thought there, and some really quite poignant statistics, and some of the things that were said at the time really give you pause for thought, I think. So we have a bit of time now for questions, and whilst people are putting those, and please use the chat function to put your questions. Could I just start off, Emma, by asking you a general question really about how Leeds, you think, compares with the rest of the country? So how did Leeds compare in terms of, I mean, obviously there was a legislative framework that applied to the whole country, but in general terms, do you think Leeds was in a better place than the other major towns and cities, in a worse place, or was it much of a muchness? What do you think?
I think it was probably much of a muchness. I mean, I think conditions in Manchester were much the same. And from some of the other reports I've read from around the country, from that 1840 Chadwick's report, I don't think Leeds was particularly different, actually. But I can't say I have in-depth knowledge. And Manchester was different because it had cotton mills rather than woolen, but actually, you know, just as much damage really to people's health.
I mean, you've obviously focused here on factory work. do you know, looking at other fields, for example, mining, presumably we saw, we could see similar figures, similar statistics for those sorts of industries?
Yes, I'm sure you would. And I mean, we know children in mines suffered, you know, again, terrible physical abuse and also deformities through crawling along very narrow passages and sort of chronic exposure to coal dust, which led to lots of problems with eyes and yes, I mean, particularly sort of chronic eye infections. So, yeah.
There's a question here from Viv, and she says, could you say a little bit more about the prevalence of TB? As our research into the health of our rural village school, which had links to Leeds, is revealing a few deaths, but no indication of wider infection. Can you say a little bit about TB?
I mean, TB was very common, very infectious, and I don't know, I'm afraid, the sort of statistics, except that it was high up as a cause of death. And as I said, although the poor were more susceptible because of sort of malnourishment and living so close together, actually we know many middle-class people died of TB as well, so including Charles Thackrah. But I think it's the sort of condition that is definitely linked to poverty and poor immunity. So that's why you see it as, you know, outbreaks in particularly vulnerable populations. But I don't know statistically, you know, how many people, without going to the burial registers, which are a fascinating resource, you could actually search by year and look at when TB started to decline a bit.
Is TB a big problem now, or is it largely disappeared from the UK as a...
No, it's still a problem. And of course, we've now got TB that's resistant to some of the antibiotics that are used. So again, it's more prevalent in poorer parts of the world. And you sometimes see it in populations that are immunosuppressed for whatever reason. But it's still very much around, and it's something, you know, public health here and the Health Protection Agency get onto very quickly so that they can contact trace and treat.
Of course, Robert Baker's work, the map that he produced was a sort of contact trace prototype in a way, wasn't it? Looking at the spread of something. Yeah. Quite interesting comparing that with what we're doing today and how effective that might be. Could you say a little bit about you know, what access children and the poor would have to medical facilities in the 19th century? You know, what would they actually do if they got ill?
Well, they couldn't afford a private doctor, but as I said, Dr. Baker was actually appointed as a surgeon a doctor to the poor. So there were some places that the poor could go. There was the House of Recovery, which in Vicar Lane, which was actually set up in 1804, and there may have been some before that. So there were charitable institutions. A lot of the workhouses had hospitals or a sort of medical wing attached, so they provided some help. And then I read, actually, there was a place in St. Peter's Square which treated ear and eye infections. And we get the hospital for women and children established in 1853. And then, of course, the LGI, which had been set up in, you know, Leeds General Infirmary in the 18th century, but then the one we know now in Great George Street came in 1868. And that provided free health care for the poor. So there was some, you know, facilities.
Roderick is asking about, you know, the attitude of mill owners, really, and whether there were any that were, you know, better than others, more enlightened than others. You know, can we point to examples where perhaps the children's lot was a bit better?
That I don't know, except that Marshall, was meant to be more enlightened because he banned his overseers from beating the kids.
Yeah.
But I think really you'd have to look at the factory reports. And I don't know about individual mill owners, I'm afraid.
It's all relative as well, isn't it? I mean, being enlightened in the context of still, requiring or allowing children to work, very long hours in incredibly poor conditions. So, even if you're incredibly enlightened, that there are certain facts about working in a mill that don't go away, no matter how well you treat the children, I guess.
Yes. Yes.
I think that's something that maybe is forgotten. I mean, my father's mother worked when I think she was 12. This is going, to the end of the 19th century. Yeah. She worked until she was from the age of 12, 6 hours a day, 6 till 12, and then went to school in the afternoon. And that was in Bradford. I mean, that was what happened. And it's not all that long ago, really. When you think, it's a couple of generations, really. That's all it is.
Actually, I did read a very interesting thing about when the Factory Acts came in. Some families actually didn't want to have the hours that their children could work cut down because they needed the income. So there was actually opposition by some of the workers to reducing the hours that the kids could work. I think it depends where you are.
Interesting question here about the sort of moral issues, really. And I'll read out the question. How did morality impact or not on the perception of the worth of a child? Christianity being the majority faith, how did people reconcile the fact that only certain elements of society were expected to work in these poor conditions, whereas maybe the upper classes didn't expect that of their children? They didn't have to, I guess, but there is an interesting moral question there, isn't there?
Yeah. Well, I think one thing that Mrs. Gaskell did was to actually portray the working class as human beings, and there was a certain otherness that perhaps the middle class sometimes thought they were other, and the poor were born to work like that and never sort of improve. So I think there was moral outrage, but it took quite a while before everyone sort of bought into that, because I think people were seen as born into a certain position and having to stay there. But there was great concern actually by many, many people about the immoral effects of working so young and of childhood really being destroyed, and innocence being destroyed, because I'm sure there was a lot of sexual abuse as well as physical abuse going on in these places. And so increasing moral concern about children of all sorts working there.
Claude asked a question, and I guess it's something that maybe to follow up on, but I mean, there are obvious parallels with child labour and slavery.
Yes. Yeah.
It's domestic slavery in a sense. It's a bit like domestic slavery in a factory setting. I don't know if anything has been written about those, the sort of the parallels that could be drawn with that, but certainly, there are parallels. The fact that it's accepted in law, the fact that that all those sorts of things.
Yes. I mean, as I said, the MPs who were campaigning did point out this terrible hypocrisy about campaigning against the abolitionists, campaigning against slavery abroad, but actually look at what's happening on your doorstep. But yes, but our concept of childhood has changed too, hasn't it? It's become a much more protective and a nurturing society rather than one that sees children. It depends, doesn't it? If you need the income from your children working, that also means exploitation too.
And I guess it's a difficult. It's Hobson's choice, isn't it, for those parents of the children? You're damned if you do, you're damned if you don't, really. And if you're in if you're as poor as they obviously were, then it's probably seen as a lesser evil.
Yes.
But it's probably just a choice of two evils in a way, but one is maybe slightly better, and a way of improving their lives overall, I suppose.
And I think there was great fear of being put into the workhouse too, so where conditions were very bad, and the poor law also made conditions in workhouses much worse.
As someone says here, it was work or starve, so
Yeah.
that was the sort of dilemma, really, wasn't it? Robert Holt asks if there were particular events that you feel or publications that really made a big difference. Looking at the various bits of legislation that came through and the different people that really pushed for change. Do you think there was one thing that really accelerated things?
No, not just one thing, but I think the whole public health movement had a huge impact on everyone's health improving, as it's basic, isn't it? Sanitation, clean water, things we take for granted totally, but many parts of the world can't. And actually clean water and proper disposal of waste is sort of top of the list in preventing disease.
Could I finish off by just asking you maybe a question about where we stand today, and maybe drawing on your experience as a GP? You say that some of the diseases that existed in the 19th century or were prevalent are very rare now, or indeed have been eradicated in this country, if not worldwide. But from your experience in medical practice, where are the problems now in the country today where we need to make further progress? Diseases, ailments,
in infectious diseases.
Yeah.
Okay. Big question. I would say immunization is absolutely crucial. We've seen outbreaks of measles, particularly scarlet fever. They do come back, and they can cause very sadly death, but also, quite severe disability sometimes. So I think immunization has been really crucial. Of course, bugs, as we know, particularly at the moment, bacteria can change, and viruses, so that sometimes some things become more virulent. And so we have to watch out that we don't, something hasn't changed and made it more dangerous. However, things like scarlet fever, actually, and the streptococcal infections on the whole in this society seem less virulent, and we're not seeing them so much, but that may be due to public health too, and better nutrition.
Emma, we've got to 8 o'clock now, and I think we promised people that the talk would last an hour, and that's really, I think, a nice place to finish. Hopefully a positive that things have improved immeasurably in the last 100 years. There are still issues that we need to look at, but clearly things are in a much better place than they were certainly 100 or 150 years ago. So I just wanted to mention a couple of things before we thank Emma and sign off for the evening. And that is to say that on the 15th of July, we have a talk from my predecessor, Dr. Kevin Grady, and Kevin will be giving a presentation on A Stranger's Guide to Leeds in 1830. So that's on the 15th of July. You can book that through Eventbrite as usual. And then I'll be giving a talk on the 29th of July, which will be a virtual tour of Leeds, looking at statues and sculpture. So 2 further talks arranged for this month. If you want to join those, please do book via Eventbrite. I should say we've recorded this talk, and for those of you who maybe want to, maybe there are things that you didn't quite pick up on, or you want to have another rerun, then we'll send you a link to that so you can watch again. So that's really all I wanted to say by way of notices. But of course, the problem with Zoom is you can't give people a round of applause. But I'm sure we're all virtually giving Emma a round of applause for an excellent and thought-provoking talk. Emma, thank you very much.
Pleasure. Thank you.
And I hope you have a nice evening, Emma, and to the rest of you, thank you for joining. We'll be emailing the talk round to everyone that attended today. So just to clarify that from the chat.
Including me, please.
Including you, absolutely.
Thank you.
Okay.
Okay.
Thank you very much. Good evening.
Lovely. Thanks very much for having me.
Thank you.
Bye.
Bye-bye.